Hello. So when we say postpartum, it is a period after delivery and it usually lasts for 6 weeks. And then hemorrhage means bleeding. Okay, so postpartum hemorrhage means bleeding after delivery, whether through cesarean section or normal vaginal birth. Usually after delivery, you are supposed to have the lochia flow. So that is the discharge that comes out from your genital tract as a result of the delivery process. And so your uterus is shedding itself, its excess fluids, excess blood, excess clot and other things, so that the uterus will be able to shrink, to become smaller, and then it goes back to its pre-pregnancy, that is within your pelvis. So in postpartum hemorrhage, we rather have a woman bleeding excessively. Okay, so with lochia, you are bleeding like your normal menses. It is not so heavy, and then it changes in color. I have videos on the lochia flow. You can also watch that video to distinguish between lochia or the normal bleeding after delivery, and then when you have postpartum hemorrhage, you'll be able to identify it and report to the hospital earlier. Now with postpartum hemorrhage, we have a woman bleeding more than expected. Ideally, after normal delivery, we expect that at most you should bleed for like 500 mils. I mean, you should lose about 500 mils of blood, okay, after delivery. And then for CS, you could have about 1,000 mils or 1 liter mils of blood loss. We estimate the blood loss after delivery or after cesarean section. But if you are bleeding more than that, some people would even bleed up to 1,500 or even more after delivery. And so with postpartum hemorrhage, any blood loss, because for some people, they don't have enough blood before they go to labor. We expect that every pregnant woman should have a blood level or HB of 11 grams and above. So if let's say you have 8 grams and you get into labor, you bleed a little, even a little below 500, and it causes changes in your system. That could also be termed as postpartum hemorrhage. So it's very important you eat well and then you go into labor with enough blood level, okay? There are two types, that is primary and then the secondary. Primary usually occurs within the first 24 hours after delivery, and then secondary happens after 24 hours up to even the 6 weeks, okay? So bleeding could be from your uterus not contracting, placenta issues, tears, and then blood clotting factors. We'll look at all these